welcome to the Director's Desk, the podcast where we highlight the groundbreaking work of the National Institutes of Health and the dedicated leaders advancing biomedical research and public health. I'm Dr. Jay Bhattacharya, Director of the NIH, and today I'm delighted to be joined by Dr. Jennifer Webster-Cyriaque. She's the Acting Director of the National Institute of Dental and Craniofacial Research. Thank you so much for being here, Jennifer. I know we've had many attempts to try to get this to happen, and finally we get to talk.
Well, thank you so much for having me, and I'm excited to be here.
First, Jennifer, why don't we start by talking about what is the work of the National Institute of Dental and Craniofacial Research? Like, what is that about?
Well, our focus is making sure that we are doing research that's going to help move towards prevention and treatment of all diseases in the dental, oral, and craniofacial complex, and recognizing that all that happens here affects not only your oral health, but your overall health.
Right. So it's part of, if I have problems with my teeth, and I've had problems with my teeth in the past, that's pretty disabling, actually.
It is disabling, but the other thing to recognize is we're not just teeth, okay? When you think about how you identify who you are, it's your face. That's dental, oral, and craniofacial. It's how you eat. It's your ability to speak, to get nutrition, to breathe, all these functions that are central to life, to communicate with other people, and to even have relationships, how you get a job. All of these things are tied. So I think that the work we do is critical.
I agree with you. Like you go to your dentist. You're a dentist, right?
I am a
You're a
dentist.
dentist. So this is not a theoretical thing. You go to a dentist,
Mhm.
and they're giving you advice about you need a root canal, or you should have fluoride. That's something we'll talk about fluoride in just a bit.
Mhm.
Here's how you avoid cavities. Here's how you brush your teeth. All of that needs evidence behind it, right?
That's absolutely true, and that's what we do. The really critical thing here is many of the diseases, all of our diseases are chronic diseases, and most of them are preventable.
That's the fun thing about your job is you mainly focus on diseases that are preventable.
Yep. And so it's a real opportunity to make a difference in a big way.
Right. So but we're going to get to the fluoride because that's going to be the heart and soul of our podcast. That'll be the fun part of the conversation. But I wanted to just to introduce the audience to you. How did you decide to become a dentist? Then how did you end up doing research? It's kind of a unique dentist that wants to do research for a living.
Well, I will share with you that when I was an undergrad, I was pre-med originally, and I was a double major, biology and interdisciplinary social science. So I took this medical sociology course, and we had to read a book by Marcia Millman called The Unkindest Cut. And when I recognized that I'd be the one to say, your loved one's dying, or there's really nothing we can do, or we're not going to ever be able to really fix this, but we're going to continue to prescribe these medicines, I better find something else to do. And so then I started to look into other fields and volunteered with a dentist who hired me as an assistant. And then I worked at the dental school that was on my undergrad campus, and decided to pursue dental because it provides me the opportunity to I like people. I'm a people person, and I've learned over the time I do better seeing people with their clothes on, right? So they come in, right? They come in. When they leave, they feel better. Either they're out of pain or they feel better about themselves. They look better. And I'm doing something that's tangible, in my opinion.
Well,
And so
some people are really scared of going to the dentist.
I know. And so this is the other thing that's important. And in fact, my area of dentistry focused on taking care of those types of people. People who were either very medically complex, they were hemophiliacs, or they had AIDS or cancer or uncontrolled diabetes, or really scared. So there are certainly things that we can do. But the thing is, if people are engaging in prevention, if we do that as a society, there'll be many fewer people that need to be afraid. There won't be an assumption because my grandmother lost all my teeth, I just need to get all mine out too. And because my grandmother said it was a horrible experience and they didn't have any Novocaine back then, we're in a different era now.
So, how did you
How
get
did I get
into
to research?
research, actually?
Yeah,
I've had great dentists in the past.
mhm.
Unfortunately, I've needed them. But like the question is like I've no they're I mean they can read research, but they don't typically do research like most of them
Yeah,
said. But
yeah.
you're an excellent amazing researcher as well as a dentist.
Thank you. Well, I will share with you that once I got to dental school, I recognized that there are a lot of things we don't know the answer to. And that's true today. And, if you go to one of our pathology or oral medicine books, it'll say idiopathic or etiology unknown. Okay. How are you going to fix it for someone if you don't know what causes it? So when I was a summer student between my freshman and sophomore years, there was an opportunity at University of Rochester to expose dental students to research. And so I did that program and I was bit by the bug because it was very clear to me that here's a very objective way to determine what the truth is. Doesn't matter where you come from, doesn't matter what language you speak. It's universal truth. And that to me was so important and a mechanism by which we can now answer those questions and see something in a patient that can then fuel the questions that we ask in our research and then bring that back to the patient. And that's what I try to do within my research and clinical program over the years. So how did I get into research? Is because I got into dentistry and there were questions that need to be answered.
Yeah, I think that's what fuels every scientist,
Mm-hmm.
curiosity.
Mm-hmm.
Um, okay, so I promised the audience we're going to talk about fluoride because that's sort of the hot button topic. But before we get into the current controversy, I want to set the stage.
Mm-hmm.
So first, what is the evidence regarding the use of fluoride and the prevention of cavities? Because I
Right.
mean, everyone's seen this. They
Mm-hmm.
see like ads that say 4 out of
Mm-hmm.
5 dentists recommend
Mm-hmm.
chewing gum. I don't know how that helps making your teeth better, but
Well, okay, I'll tell you about that in just a second.
okay,
So let me back up a little bit bigger picture and share that fluoride is one of the tools that we have
okay.
to help us maintain good oral health. Okay, it's one of the tools in our arsenal. Being able to get to the dentist,
Brushing your
right?
teeth every day,
Brushing your
flossing.
teeth and good oral hygiene. It's accumulation of all of these things that help us move to good oral health and then good overall health. What is the evidence that fluoride does something? There are two places where fluoride is really important. As you are developing, like when you're in your mom's belly, um, that fluoride can get incorporated into the developing tooth, okay? And what it does is it makes the tooth harder. So once the teeth come out, they're going to be resistant to the bad guy bacteria that make these products that cause acid and make the tooth dissolve because of the acid, okay? Likewise, when you're brushing your teeth with fluoride or getting fluoride from perhaps your water, um, there is an ion exchange where the fluoride is then incorporated into the hardest part, which is the white part of the tooth, the outside. Once it gets incorporated, it makes it harder. So once those bacteria secrete that acid, it's not going to be as successful. Now, why are they secreting that acid? Because you're eating, or we, or I, are eating something that has sugar in it or carbohydrates, right? And that's what these bacteria feast on. So, modifying our diet and our nutrition can also make a difference. But it really is a combination of all of these things, kind of a holistic approach, with fluoride being one of the things that helps us.
And of course, there was that new dietary pyramid where sugar was always you're not supposed to eat too much of it, but it really emphasizes kids, especially very low levels of eating sugar is necessary, not just for diet, not just for your teeth, but for your whole body.
That's absolutely true. Added sugars are a major challenge, and actually, NIDCR has been working closely with the FDA on pulling out the evidence because here's the place where there's a direct dose response. More sugar, more cavities. We can see that in animals, we can see that in clinical trials, we can see that in vitro. So we're working with the FDA on pulling that evidence together to provide that clear link. Um, but your diet makes a difference. Sugar's pro-inflammatory, worsens other inflammatory oral diseases, but also is the food for the bad guy bacteria to cause the cavities.
What do you think of the new policies to remove the ability for people on SNAP, on food stamps, to buy sugar sweetened beverages?
So I think there's a value to that. There's a value in that. And actually, we've seen in some other countries where they've reduced the size of their soda cans and decreased sugar intake. There's been some significant uptake from those populations.
Yeah.
But wouldn't it be great if on Snap you could also get a toothbrush and some
Toothpaste.
toothpaste, right? Um,
Um,
so that
of course,
combination
a
of
dentist
diet and
wants that,
care.
Jennifer. No, I'm just kidding.
Yeah.
Um, all right, so let's get back to fluoride.
Hmm.
There's a history in the United States of fluoride being put in drinking water,
Hmm.
and that goes back decades and decades,
Hmm.
right? So there's I think there was a movie, Doctor Strangelove, where there's a conspiracy theory about why fluoride is being put in. I mean, of course, everyone made fun of the conspiracy theory because
Hmm.
it's not a mind control device or whatever it is. What the conspiracy theory was, but uh, why was the decision made in the 1950s to supplement drinking water systems in the United States with fluoride?
Yeah.
And not every by the way, not every local water system has it. Some do
That's
and some don't.
absolutely true. That's absolutely true. And again, there's naturally occurring fluoride too across the United States that occurs at different levels.
So let's go back to the
Yeah.
1950s. So
In the
what's
1950s, what else was happening? World War II. Okay.
we were at 40s and the 50s had come out of
40s and
World War II.
50s.
Yeah.
That's right. And so during that time, there was a significant challenge in enrolling people because many of them had dental issues
In the army or the
into the
military.
that's exactly right. And what it was determined was there were certain regions where there were higher levels of fluoride and there was less dental disease. There was actually an experiment done by Trinley Dean, who became the first director of NIDCR, um, called the Grand Rapids, Michigan experiment, where over time they could see with adequate levels of fluoride, they had much lower levels of dental disease.
But why put it in the drinking water? Why not just uh, put it in toothpaste and
Mhm.
encourage like better? Why
Yeah.
was the decision made
So
to
the
put it in drinking
drinking
water?
water helps to provide more universal access, right? So that everybody can get it, irrespective of where they live, what they are, what their income is. And I think that's why it's a was a actually had been lauded as a top public health intervention for that reason. When you think about the cost of the intervention and access to the intervention, water is a great vehicle to get it to people.
Did it work? So in the 50s,
Yep.
there's a you implement 40s and 50s. You implement the
Hmm.
drinking water in some fluoride in drinking water in some places.
Hmm.
Did cavity rates come down?
So we have seen cavity rates come down, but they have not gone away. They have not gone away. And in fact, what we know is when we take fluoride out of the drinking water, and that's been done in a couple of countries and also here in the US, in Juneau, Alaska, and also in North Carolina. When you take it out of the drinking water, you see a doubling of dental disease, a doubling of decay. So it definitely does make a difference. Um,
Right. And so now, I mean, I've had multiple. Full confession, I was addicted to sugar when I was little. I loved Halloween,
it's okay.
uh, and
It's
I
okay.
have cavity. Literally every single tooth has a filling. I'm a dentist nightmare. Um, uh, is it so bad? What? Why are we so concerned about cavities? I mean, my teeth have fillings in them. My
Mhm,
mostly healthy teeth now.
mhm.
Why is that so bad?
Well, because it's an infection, and infections lead to inflammation. And inflammation leads to horrible consequences. So we often think about it, oh, you just go to the dentist and da da da. Well, what if you don't have a dentist?
Yeah,
And it progresses. And then you have a big infection. And that big infection will then move not only from your mouth to your brain and throughout your blood, and people die,
yeah. I
right?
remember you were telling in preparing for this. We had a conversation. You were
Hmm.
telling me about some. I mean, it sounded like horror stories, but they're true stories
Hmm.
about cavities that are untreated, essentially leading to child deaths.
Absolutely. And deaths of adults as well. And so in, let's see, July of last year, there was a child in North Carolina who was less than 3 years old who died. There was a child here in Maryland a few years back named Diamante Driver who had a toothache, but didn't have dental insurance. And so they went to the dentist. They weren't able to be seen. They went to the emergency room, back and forth, pain meds, antibiotics. This child developed a brain abscess and died. There was an 2 years ago, a player in the NFL, 36 years old, had a bacteremia or bacteria from the decay got into his system. He died. This is very underreported, and it happens way too often.
I've also seen evidence that poor dental hygiene, uh, sort of the bacteria you were talking about
Hmm.
earlier in the mouth, can is associated with heart disease and other sort of systemic diseases that you
Yeah.
wouldn't think about necessarily.
Yeah. So there have been significant associations with cardiovascular outcomes, with worsened control of diabetes, with dementia and Alzheimer's disease, with pregnancy outcomes, with preterm labor and low birth weight. So it's pretty significant, and we don't think about it.
And all of it's preventable with essentially good dental hygiene.
Good dental hygiene.
Okay.
That's right.
All right. So brush your teeth, folks. That floss. I mean, that definitely help. Um, okay. Back to fluoride because that's the through line for our podcast. So the it's put in water systems. There's a fair bit of political resistance when it's first put into water systems. Like
Hmm.
I referenced Dr. Strangelove, and that was lampooning some of the political resistance.
Have you ever heard of a thing called fluoridation? Fluoridation of water?
Uh, yes, I have heard of that, Jack. Yes, yes.
Well, do you know what it is?
No, no, I don't know what it is now.
Do you realize that fluoridation is the most monstrously conceived and dangerous communist plot we have ever had to face?
But there was political resistance. People
Hmm.
worried whenever you put uh, other chemicals and things in water system. I mean,
Yeah.
but everyone's drinking water,
Hmm.
um, and you may not have the scientific background you're talking about, you know about, but and so there's worry, right? That
Hmm. There have been some, and to abate some of those concerns, there have been lots of studies that have been performed. There was some significant concern back then that this caused cancer. And there was some really good work from the National Cancer Institute in large, well controlled trials that this was not the case. Um, right now, there are questions about neurocognitive
okay. So
disease.
I this
Yeah.
is so let's move forward to now.
Hmm.
And in fact, I just looked up some of the literature on what you just said, right?
Hmm.
So the worry is that if you are exposed to too high levels
Hmm.
of fluoride. If normal levels of fluoride, like there's a safe range where there's not that this doesn't happen.
Hmm.
But kids, especially, and maybe moms that are that are have babies in utero,
Hmm.
um, if they're exposed to too high levels,
Hmm.
then especially kids have. When you say neurocognitive, it means the literature says that their IQ might go be lower than it otherwise would be. That they suffer behavioral problems, and this is evidence that's come out from lots of different places. Like I saw a study from Germany it's a meta-analysis that it said that published in 2020 that 21 of 23 epidemiological studies report an association
Hmm.
between excessive fluoride levels
Hmm.
and and IQ problems, or neurocognitive problems. The Canadian study looking at moms exposed in utero, the kids exposed in utero with lower IQ for kids later on,
Hmm.
again for too excessively high fluoride levels.
Hmm.
Um, so there does seem to be something to that, right?
Mhm. Well, this is the area of opportunity. So, in the meta-analysis that actually came out of NIH, it was determined that this being over this particular level of 1.5 parts per million was associated with a 1.6 decrease in IQ points. Those data came from places where the levels were really high. The area of opportunity for us is to determine what's happening here in the United States. So
Well,
that,
so
go
before
ahead.
we get to that, I just wanted to like so
Mhm.
this is a legitimate concern. It's not a I mean because I was looking at the literature. I confess like I didn't know about this literature before
Mhm.
just maybe last year, and I started looking into it, and I thought that I guess I still had the impression I'd gotten from medical school that the debates over fluoride were already resolve. But when I looked at the literature, it seems like they're really, especially in recent years,
Mm-hmm.
a fair bit of like high quality epidemiological studies suggesting, again, not for normal levels of fluoride exposure. That
Mm-hmm.
there's no correlation.
Mm-hmm.
That there's no harm at all. But
And when you
for
say normal, you mean recommended levels.
recommended levels, sure.
Okay.
Yeah.
Just make sure I'm understanding.
Yeah, I mean, right, levels that are recommended to prevent cavities, which, as we said, is very very important. But if you're above the recommended levels, a certain amount,
Mm-hmm.
then you start to get some of these correlations with lower IQ, neurocognitive behavioral problems in kids, especially.
Yeah, so I think there's certainly opportunity to do additional studies to firm up some of those studies. I think that you have to think about where the data is coming from. Do you have endemically high levels of fluoride in these areas, and how the questions being asked? How are we measuring the fluoride? So I really think there's a place for science to help us really nail down what are those neurocognitive effects in large, well-controlled cohort studies.
Okay. Um, all right. So let's just stipulate, for
Hmm.
the purpose of the policy discussion we're about to have,
Hmm.
that the correlation with high levels of exposure with neurocognitive problems is established. Let's just stipulate for now. Um, I hear some skepticism in your voice. I honestly, like, in my reading of it, I came away. I moved my priors in the direction of, yeah, there
Hmm.
might be a problem here. So in order to have the discussion about the policy, let's say that there is a problem.
Hmm.
Even if I hear in your voice a
No, no,
little bit of
no.
disagreement.
But I just think there's more that we need to understand.
Yeah, well,
Hmm.
that's true. So that's this is science, right?
Yep.
Um, okay, so uh, let's think through this, right? So you have, on the one hand, amazing evidence that if you have too low levels of exposure
Hmm.
to fluoride,
Hmm.
that you're going to get cavities. You're
Hmm.
going to have worse teeth. You have potentially the health problems associated that we talked about associated with that. Are potentially very bad, especially if you don't have good access to dental care, or your dental hygiene is not so good. Um, and on the other hand, again, we should stipulate for the purposes of argument that if excessive levels
Hmm.
might correlate with worse outcomes for neurocognitive outcomes, especially for kids. Um, what do we do with that from a public health point of view?
Yeah. Well, let's qualify it just a little bit. When we think about bad outcomes, okay, a drop in IQ of 1.6, that could be problematic. But the other thing that could happen if you have untreated decay, very clear evidence there are very poor academic outcomes as kids are missing school, they're having pain, they're having these other challenges. It decreases work productivity, it decreases our military readiness. So so we need to look at the holistic, take
Right.
it
So
from a
that
holistic view.
this is
Yeah, yeah.
exactly the right framework,
Hmm.
the frame, right? So, on the one hand, you have benefits, and one hand, I'm an economist. This is I
Yep.
always think about like
Risks and
benefits,
benefits.
risks
Hmm.
and harm, benefits and harms, right?
Hmm.
So, but you have a trade-off here,
Yep.
um, and it's a dose response trade-off. Too
Hmm.
low, you get a lot of the harms from the tooth decay, and all the stuff you just
Hmm.
talked about.
Hmm.
Too high, you potentially get neurocognitive issues, right?
Hmm.
So the question from a public health point of view is, how do you, if again, let's just take as
Yeah.
given that we agree on the evidence summary, how do you manage that?
Well, let me tell you what the US is doing right now to manage that.
Okay.
Okay. So the levels have been set based on harms, specifically those associated with what's called fluorosis. Okay. And there's fluorosis that occurs in your on your teeth. They get discolored. Okay. And this fluorosis,
Fluorosis means like too high levels.
too high levels.
Okay.
And what are too high levels? So the recommended levels in the US are about 0.7.
0.7
If you zero
units.
point 0.7 parts per million in
Okay.
your water. If you are at a level of 2, which is above the 1.5 level we talked before, then you're at risk for dental fluorosis, and that's discoloration of your teeth. Okay. If you're at a level of above 4, then you're at risk for skeletal fluorosis. So, why am I bringing that up? Because the Environmental Protection Agency, when people are at level of 2, and all of the public water systems are tested on a regular basis. And those people who have wells across the US can go to their community center, someone in um, their community governance, and have their water measured. And if you're at 2, you get a warning. And if you are at 4, you're told not to drink the water. Okay. And so that's happening right now for every county and every system across the United States.
Now, not every system adds fluoride.
That's
Some
right.
some systems don't. And you showed me a study that you worked on, which I thought was really neat, looking at a representative sample of people across the country
Hmm.
and looking at the fluoride levels in the water. And the vast majority of the country are not are not exposed to excessive fluoride levels in there. But there were a few, like I think it was like 1% of the sample you looked at.
That's right. So if 1.5 is the
1.5,
letter,
that's right.
right,
Yeah.
is the metric, they're about less than 2% of homes in the US that have that experience.
Yeah.
The mean amount is actually 3 times lower than that. It's 0.5.
Right, but I'm worried about the 1 point.
That's right. That's right.
So that's
And those people get warnings.
okay. So now let's
Hmm.
think this through, right? So
Hmm.
fluoride in the water is not the only way you get access to fluoride, right?
That's
so,
right.
So like there are fluoride
In some
supplements.
foods.
Well, it's fluoride in foods, of course, but there's also supplements. If you brush your teeth,
Hmm.
you get fluoride. There are other ways to deliver.
Hmm.
Adding fluoride to water means that everyone's getting. Actually, even that's not true. It depends on how much water you drink.
That's right. And so what we really need to do is answer the question, what are the cumulative amounts of fluoride that we're getting? And how will that impact your health moving forward? And those are some of the types of studies that we're working with NIEHS, or the
National
National
Institute of Environmental Sciences. Yes.
That's right, under this research agenda on fluoride that's an FDA NIH collaboration to be able to answer those types of questions.
I mean, just for folks that are listening, it's not a 1-0. Do you have fluoride in the water? Yes
Hmm.
or no. That's really not the key thing. Is what I'm hearing. What I'm hearing is like there's multiple ways to essentially address the risk of tooth decay.
Hmm.
Um, the level of fluoride you get depends not just whether there's fluoride in your water system. I
Hmm.
think like 30-40% of water systems in the U.S. don't have added fluoride.
Hmm.
Um, but there are other mechanisms that you can have for fluoride delivery, right? So and that are more individually tailored rather than like a whole population tailored.
There are, however, what we know from that same study is it's not a one size fits all.
Yeah.
It's not a magic bullet. So what we know is even if you're brushing with toothpaste and that has fluoride in it, and you live in one of those places where there is no fluoride in the water, you'll have untreated decay. Even if you're doing some of these other things, you're getting fluoride in the foods that you eat, and you're brushing. If we then remove fluoride from your water system, you may have issues with decay. So I think we've got
I
to
mean,
look at it holistically.
I mean, given all right, so let's just talk about Europe for a second, right?
Hmm.
In Europe, there's no very few water systems where there's fluoride
Hmm.
supplementation. Um, it's not it's I guess what I'm trying to get at is that the right solution isn't obvious here, right? Like there's lots of different levers you could use in
Hmm.
public health.
Hmm.
Fluoride in water systems is
Hmm.
one lever,
Hmm.
but there are other levers such as encouraging, use of regular brushing,
Yep.
regular floss.
Hmm.
You said snap
Yeah.
you can buy toothpaste with snap.
Yeah.
I'd be in favor
Yeah.
of that.
And I'll also share access to care because that's what Europe has. So, so part of their healthcare system is making sure everybody has access to dental care. That's what we don't
Although
have
under the
here.
UK they famously have worse.
But I'm going to tell you
Yeah.
something. Look at them now.
Okay, are they
If you
better
look
now?
at them 20 years ago, or some 30 years ago, when they may not have had this same situation with the UHS and people who have access to care, they've really improved. So if the US were to have a system like that where people all had access to care, then fluoride, may not be as important. We can see significant differences between people in higher economic strata who have access to care And
but
those
like
that don't, even if they have fluoride in their
but
water.
even, okay, let's
Yeah.
just take the U.S. access to care is given. Like, obviously, it's better for folks to have access to dentists, but like, let's say we're not going to be able to change that. I mean, we're not in
Oh
charge
no
of that
no.
policy,
Yeah,
model,
yeah.
right? So like, so take it as given. Um, is fluoride in water really the right way to do that? Like, so for instance, the amount of fluoride you get isn't just is it in your water; it's how much
Mhm.
water you drink. Do you drink bottled water instead of tap water?
Mhm.
It seems like the dose that you're delivering is not tightly controlled if you're just putting the fluoride in the water
Yeah.
systems.
So two things. Okay. One, again, we know if you take it out of the water systems, irrespective of what you're doing, decay levels will go up. We are doing some studies now to answer those questions where we're actually getting all the data on what are people eating in terms of, and how, what are the other sources of fluoride that they're getting, and then randomizing in counties where they don't have any fluoride in the water to, they're randomizing no fluoride to fluoride at the recommended levels, and that will help us understand.
So
Bec-
fluoride delivered by toothpaste, by
so
supplementation,
by food,
by food.
right? By
Yeah,
shrimp, other tea, coffee, other things like that, so that they're getting really good sense of all the different sources and what the cumulative levels will be. And then and then we can measure it and actually determine the answer to your question.
right. Well, so it sounds like what we need is more science,
We
actually,
need more
right?
science
I
and
mean,
we need to apply it.
yeah.
Hmm.
Um, so I mean, I think then what do you recommend someone in the United States do? Like, they're kids and they're living in a district where they have no fluoride in the water.
Hmm.
Would you recommend that they have different management of their teeth and what they do with their kids than
Yeah.
if they're living in a district with fluoride in the water?
So I would recommend that they touch base with their pediatrician and or their dentist if they have access to a dentist and hear from them, because those folks are in the area. This could be a scenario where I'm in West Texas and there's already high levels in the water that are not in a public system.
Yeah,
Or maybe I'm in Maine or New Hampshire, levels are really low. So that's what I would suggest.
right. And the key thing is overall health of the people, right? So
That's right.
it's one fluor. We've been talking about fluoride because it's the hot button topic, but I want to bring back to where we started the conversation. It's one element of health, but our teeth are vital to our overall health
That's right.
and our habits, what we eat, even aside from fluoride, how we how we manage our lives actually have pretty important impacts about the links between your teeth and and the rest of your body.
Agreed.
And,
Agreed. I'm just go back to one of the first questions that you asked, and that was what was happening in the 40s and 50s. And again, it started with our military, right? And today, right now, 37% of our military that's not deployable is because there's a dental issue. So there are real opportunities for us to move prevention forward, integrate it so that people have better overall health outcomes.
and so how can the NIH help? Like, how are we helping
Yeah.
in informing public health,
Yep.
informing public policy, informing people?
Yep. So it's us working to get the evidence and moving it from the research, from the papers that we write to the people. That's what we have to do. And so I do think these questions that have not yet been fully addressed, now's the time. Working across agencies, across institutes and agencies to answer these questions and make a difference for the public.
Right. Well, Jennifer, thank you for your time, and thank you for your expertise, and thank you
Oh,
for your public service.
glad to be here.
All right. Well, thank you for joining us today on the Director's Desk. To our listeners, thank you for tuning in. Drop your comments in the comment section and be sure to hit that like and subscribe button on your preferred podcast platform. Until next time, I'm Dr. Jay Bhattacharya, and this has been the Director's Desk.